Before you agree to spine surgery, there are 5 crucial topics you need to discuss with your surgeon that most patients don't know to ask about. In my years as a board-certified neurosurgeon specializing in spine surgery, I've noticed a concerning pattern. Many patients come to their consultation focused solely on when they can have surgery, believing it's their only option for relief. They're tired of living with constant pain and numbness. They're worried about weakness that seems to be getting worse. And most importantly, they're terrified of making the wrong choice about their care. But here's what's critical to understand. Spine surgery is a significant decision that requires careful consideration and clear communication with your surgeon. Today, I'm going to walk you through the 5 essential conversations you need to have during your spine surgery consultation. These discussions often reveal crucial information that can completely change your treatment path. And as a board-certified neurosurgeon, these are the exact conversations I have with every patient before surgery. The first critical conversation you need to have is about goals and benefits. This might seem obvious, but it's actually where many patient-physician relationships can become misaligned. Let me explain why this matters so much. Your goals and your surgeon's goals must align perfectly for optimal outcomes. For example, your primary goal might be to cure your chronic low back pain, but your surgeon's goal might be to improve your leg pain. This misalignment happens more often than you think, and it could lead to disappointment after surgery if it's not addressed up front. During this goals discussion, you need to be extremely specific. Ask your surgeon, what exactly is your goal for this surgery? What specific symptoms will it help with? What symptoms might it not help with? The answers to these questions might surprise you. Sometimes a surgery aimed at addressing nerve pain might actually put you at higher risk for worsening back pain. This is exactly the type of information you need to weigh carefully before proceeding. The second crucial topic is understanding the risks of surgery, and this requires a thorough, honest discussion. Every surgery has risks, and it's critical to understand them fully. In spine surgery, we need to discuss several categories of risks. First, there are standard risks that come with any surgery requiring general anesthesia. These include problems with the health of your heart and lungs, wound infection, poor wound healing, and blood clots that can travel to your lungs. Then there are specific risks related to the spine surgery itself. When discussing these risks, we need to be precise about location-specific complications. For instance, neck surgery carries very different risks than low back surgery. In neck surgery, we need to discuss potential risks to the esophagus, trachea, blood vessels carrying blood to and from your brain, the nerves controlling your ability to swallow, and the nerves controlling your vocal cords that allow you to speak clearly. For low back surgery, we need to discuss different specific risks. For surgeries requiring placement of hardware to fuse parts of your spine together, these procedures have very different risks than surgeries where hardware isn't placed. Understanding these risks helps you make an informed decision about whether the potential benefits outweigh the harm. Is the goal of surgery worth the risk? Now, the third essential conversation is about alternatives to surgery, and this is where many conversations fall short. It is crucial to understand every non-surgical option available before proceeding with surgery. Have you tried everything besides surgery to treat your symptoms? This includes specific treatments like injections around the nerve or joint, physical therapy, specific stretches or yoga, and aquatherapy. Weight loss programs and various medications might be alternatives to consider. And while you're discussing alternatives, be specific about what you've tried and for how long. Sometimes patients think they've tried everything when they haven't given certain treatments adequate time or intensity. For example, physical therapy for 2 weeks is very different from a comprehensive 3-month program. Similarly, one type of injection might not work, while a different type of injection could provide significant relief. The fourth critical discussion is about expectations, and this is where you need complete clarity about your goals of care and your recovery journey. This conversation should cover both the early postoperative period and long-term expectations. You need to understand exactly what to expect after surgery. Will you experience substantial pain? How long will that last? Will you require help at home for daily activities? When can you drive again? Will you need time off work, and if so, how much? This discussion should also address the possibility of needing additional surgeries in the future. Some conditions might require staged procedures or have a higher likelihood of needing revision surgery. You need to understand these possibilities before proceeding. Now, the fifth and final crucial conversation is about specific postoperative instructions and limitations. This isn't just about general recovery. It's about understanding the exact restrictions on your activities. Some patients might need to wear a brace or a collar for a period ranging from weeks to months. You might have specific restrictions on bending, lifting, twisting during your recovery period. These limitations can significantly impact your daily life. If you enjoy activities like hunting, horseback riding, cycling, off-roading, you need to know exactly when you can safely resume them. If you have upcoming travel plans, you need to understand if and when it's safe to travel a long period of time in an airplane or carry your luggage. You need to understand when you can submerge your incision should you want to go in a swimming pool or another body of water. If you have a physically demanding job, you may not be able to return to full duty for quite some time. You might be limited in what you can do at work once you return. It's crucial to understand these details before scheduling surgery. You need to make the right decision for you, and you need to be prepared for the recovery and all it entails. Here's what's essential to understand about all of these conversations. They require time and attention from your surgeon. If you feel rushed through any of these discussions, that's a red flag. A meticulous surgical approach starts with meticulous pre-surgical planning and patient education. Your surgeon should be willing to take the time to address all of your questions and concerns thoroughly. Remember, spine surgery is not just about the technical procedure. It's about achieving the best possible outcome for you as an individual. This requires a clear understanding and communication between you and your surgeon about all aspects we've discussed. These 5 crucial conversations can be the difference between a successful surgery and a regrettable decision. I've seen patients completely change their treatment path after having these detailed discussions. Sometimes toward surgery, sometimes toward alternatives, but always toward what is truly best for them. If you're considering spine surgery, save this information and use it as your consultation checklist. Understanding these topics thoroughly will help you make an informed decision about your care. Remember, the key to successful spine surgery isn't just about the technical expertise of your surgeon. It's about having a complete understanding of your condition, your options, and your expected outcome. Take the time to have these critical conversations. Your spine health is worth it.